want to do the Valgus stress test, which means you're pushing just above the knee, you're pushing the femur medial, and you're pulling the tibia inferior and lateral. And what that does, if things are lined up, that evaluates for tears on the upper or lower fibers of the medial collateral ligament. Typically, the pain won't be in the joint line unless it's meniscus related. Tests like that will be good for MCL tears. For the lateral collateral ligament, for the sake of the video, I'm going to show it here. Again, when you test this, you can see that Fran's tibia is rotated laterally. So in order to take out the torsion of the ligament, I'm basically rotating the femur, the tibia medial, to line it up with the femur, which means later on we're going to be, again, talking about the importance of the biceps femoris. When I get that rotated where the femur and the tibia are lined up, then I get a more reliable varus stress test. Varus stress test where I'm pushing the femur lateral, pulling the tibia, the fibula in this case, inferior and medial, and if the joint is gapping, it's been ruptured. So you got to be careful, do it gentle at first, and if there's a tear up here, that's something that we can treat that. We can treat those. So we're looking at the varus stress test, pushing the femur lateral and dropping the fibular head inferior and pulling and just creating a little stretch on that ligament. Now, when we get into the meniscus, we basically have the MacMurrays test. So what we want to do to check for problems in the medial meniscus is we want to externally rotate the tibia. We want to apply a valgus force, a medial force on the knee, and we want to see if there's popping or clicking or pain. And in this case, this particular version of the MacMurrays test would be identifying a injury in the medial meniscus. Now when I go the other direction where I'm bringing the tibia internally and I'm putting my fingers right on the joint line here, and then I'm pulling the femur towards me, and this would test for lateral meniscus tearing fibers. You would hear a popping or a clicking sound, and I do seem to identify those sounds and that condition. So there's something catching in the meniscus as I do the MacMurrays test. So these important tests are critical because we don't know what really is going on unless we do the orthopedic assessment test. Fran, I'm going to have you go prone. I'm going to do a couple more assessment tests before we start the treatment. Now, Fran did injure her meniscus on the right side. Another confirmation besides the MacMurrays test for the medial or lateral meniscus is called the applique compression test. When we compress and trap the meniscus between the tibia and the femur and we rotate, Fran, do you feel that on the right or left side in your knee? Which side do you feel that pain on? Feeling it right about here in this joint line? So I oftentimes will palpate the joint line and help them to identify where that meniscus. Now, if it's a bucket handle tear, what will happen is that there'll be a piece of it flipped in and wedged into the joint. A lot of the times you will see that the last 20 degrees of knee extension not being available because what has happened is that piece of that meniscus has torn and then doubled itself up and locked itself in the joint. And sometimes trying to get that last 20 degrees of knee extension in there is not going to be a likely thing. They may have to do surgery. However, with the meniscus, they need to remove as little as possible. Anytime you remove the meniscus, what's going to happen is then the femur and the tibia are going to start to grind down, and where degenerative arthritis and bone spurs, when you take that out, is more likely going to happen than ever before. So we don't want to remove any of that meniscus. Later on in the video, we'll be showing you some meniscus glide exercises. The only thing that's going to get blood flow back to the outer third of that meniscus, which was where her tear was at based on the MRI, is some motions of rotation and non-weight bearing position, as well as we want to get in and get some anterior lateral glide of the tibia and the fibula to get that meniscus to heal itself. The only thing that heals these articular ligaments and this meniscus is movement and increased blood flow due to these relatively non-vascular structures. So by identifying, and then the last thing is, in our history input, typically if they had a force come to the outside of the knee, you'd be looking for medial collateral ligament injury. If they had a force where their tibia hit the dashboard, you'd be looking for PCL rupture or injuries. If they have a non-weight bearing force where their foot's turning internally and then their femur's going forward, which usually comes from pronation of the foot, that can actually injure the ACL. The ACL, they say in athletes, is probably injured in non-traumatic situations due to the overpronation of the foot, destabilizing the knee, and it just ruptures the ACL. The last thing I'm going to talk about is the Penzance-Sorinas condition, where the attachments of the semitendinosus and the attachments of gracilis and sartorius all attached down here, just about 2 finger widths below the tibial tuberosity. And these attachments, actually, there's a bursa sac in there. Now remember, with tibial torsion, that's overstretched, and the tissue's probably never going to heal. So basically, part of our hands-on treatment, again, is going to be showing you the biceps femoris work, showing you several ways to get rid of torsion. And what that's going to do is that's going to relax the Penzance-Sorinas to allow for proper healing to happen. Because of the bursa sac, there is this controversy whether we should friction that particular tendinosis, because sometimes it's a bursitis and not a tendinosis because of the inflammation of the bursa sac. So what's going to be key here is putting the knee, getting the rotation out of the knee when we start treatment, and then sometimes repeating some of the tests. The test is always done to assess if the problem's there, and then a second assessment done is always done to assess if the problem's corrected. So I look forward to showing you all these treatments in the next section of this DVD. Okay. Captured everything?
Yep. Say hi,
that
Jim.
That was the hardest part.
I'm falling asleep.
Don't